Hello, my name is Laura Salinas. I'm a student at Nightingale College. I'm a nursing student at Nightingale College. I'm in BSN266, section number 5. I'm going to be performing tracheostomy care on my patient here today. We gathered our supplies, which I have extra gloves just in case I need them. I have hand sanitizer for hand hygiene. I have my tracheostomy kit. It is tamper with just because I've been doing this video a couple times already. This is my last pair of sterile gloves, so I'm going to try to do my best in this video. I have normal saline and I have my soaking solution. So before we even start, we gathered our supplies. We make sure that this is not tampered with. Of course, we make sure even before we even get the supplies that we have a physician's order, which I already have. So we have our physician's order. We gathered our supplies. Our supplies are good. They're intact. The expiration date is still good, valid. I'm gonna go ahead and go into our patient's room, knock, knock, introduce ourselves. Hi, I'm Nurse Laura. Perform patient privacy, hand hygiene when we go into the room. Identify the patient with 2 identifiers. Explain the procedure and what we're gonna do. They agree, they already knew about this. Not the first time they had a trach. And we're gonna go ahead and make sure that our oxygen is available and on. Our suction machine is available and on. We have everything here. We're gonna go ahead and raise the bed to our comfort level, and we're gonna place them in a semi-Flowers or a Flowers position, depending, as long as there's no contraindications. We are also going to do a cardiopulmonary assessment first. We'll check full set of vitals. We're going to have a pulse oximeter on them the whole time during the procedure to make sure that we're monitoring their oxygen status. Throughout, we are going to pre-oxygenate them 30 seconds prior to even performing the care. Ask the patient to take deep breaths, suction if needed. I believe that's it. We can go ahead and start. So first thing I'm gonna do is hand hygiene again. We're gonna go ahead and put on some gloves. We're gonna go ahead and take off the pre-gauze. Ask them if they're doing okay before we even start. They verify they do. We're gonna go ahead and take off their gauze. We let them know. Go ahead and take that off. Now we're gonna take off these gloves. We're gonna open our tracheostomy kit. I just wanna make sure I have enough space here because I did that earlier and I messed up. I just want you to see him as well. It's gonna be a little hard. So we're gonna go ahead and open our kit. We're gonna be very careful not to touch the inside as much as we can. Go ahead and perform hand hygiene again. It never hurts. We have this little paper that we're gonna fold out to make the space sterile. So we wanna grab this just from the corner as much as we can, wherever we can, just the corner tip. We're gonna move this off to the side for just a moment. Just grabbing the corners. We're just gonna open the paper and it's gonna be the shiny side down, okay? Oh, this is over here. Sorry, buddy, I bumped you. We're just getting the corners to adjust wherever we need, just that corner. I'm gonna move this over here, over here. And so now I'm gonna wanna dump all the inside of my stuff on my sterile surface. I still wanna keep the inside of the sterile because now what I'm going to do is I'm gonna put my normal saline in 2 spots. One for my Q-tips and one for the cannula, and then I'm going to put the soaking solution in the bigger side. So now that I have those here, I'm gonna just put this off to the side. Again, it's gonna be right here. I wanna see how I can, sorry, you're probably not gonna see me too well. Oh no, that's not good. Okay, let's just do that. Okay, it's here. I will move it in between if I need to, but this is a sterile surface. I'm gonna go ahead and perform hand hygiene. We're gonna go ahead and get our gloves. Again, we wanna get those from the corner. Go ahead and just from the corner, we're gonna just scoot this over. We're gonna open these up. I wanna put it down, cuff side down, open these papers out. Be very careful to not touch these gloves. They are sterile. Okay, ready? Sterile technique. Just touching the inside of that glove. I'm gonna go ahead and shimmy my hand right on in. I just can't get that thumb. So I'm just gonna, yeah, I just had to pull that part a little tiny bit. Get my thumb right in there. I'm not touching the middle or the outside of that, still touching the inside, and we're just gonna shimmy it down just like that, you see? Now, I'm gonna get the cuff side on the other side of the glove to get my other hand in. Just touching the inside of that still. We're gonna go ahead, get our hand in there. For this one, unfortunately, I have to just shimmy it around. Still touching, it's not necessarily the inside, it's like the outer side of this glove, and just pulling it down just like that. And I think that's at comfort level. I'm not gonna touch them the rest of them again because it's sterile. Go ahead and just throw that down for a second. So now, all sterile, we're gonna go ahead and just move this over just so you can see where I'm at. My Q-tips that I wanted, I'm gonna go ahead and soak them in that third spot that I said I wanted these in. My gauzes, I have everything here. A couple of these. All right. So, sterile gloves, first thing I want to do is I want to get my Q-tips, and I actually want to clean around the area. I'm going to clean on the top and just kind of gently, and it's going to go in the designated dirty area. Everything's still sterile. I'm going to go ahead and grab another one. We're just going to clean off to the side. Designated dirty area. We're going to go ahead and do the other side. Designated, and then the bottom for last. Now we're going to get a gauze, and we're going to pat dry the area. We're just going to pat dry. Just pat dry. And then now we're going to go ahead and pull out the cannula. We're going to unlock it first. I'm going to go ahead and do that, okay? And we're going to let them know they're okay, they're fine. We're going to go ahead and soak it in that solution. Let that soak for a moment. I'm going to go ahead and grab my brush, and we're going to grab it after it's soaked and rub off any excess that we need off. And of course, I'm doing it here. I'm just showing you for the video purposes. Then we would have it soak in the normal saline to get any extra residue or anything like that. I would leave my sponge in the dirty little area. I'm gonna go ahead and grab this out. After it's dry, we're gonna go ahead and place this back in, and we're gonna go just straight in like that with that curve. We don't wanna do it any other way. We're gonna let them know we're gonna go ahead and do that. They need to take a deep breath. We're gonna go ahead and go in. Perfect. We're gonna go ahead and lock this in place. That is good. So the area is clean. The inner cannula is clean. Now we're gonna go ahead and change the trach tie. This is normally a 2-person assist. Anytime doing trach care, especially when you're changing out the ties, so that way there's someone else holding it. For this video purposes, we're gonna say that someone is here. So we're gonna go ahead and change out the trach tie, which I have one here. I just wanted to make sure. We're gonna go ahead and untie this. I would like to say I did the other side first, but I needed to do both. And we're gonna gently just go around. Again, someone's holding this in place for us. That way we're not doing it alone. Oh my God, no, please, I did not do that tight. I got you, bud. Okay, that is off, that is good. I'm gonna go ahead and put the other one on. During the cleaning and during this procedure too, we would also assess the skin integrity and the stoma and make sure everything's okay in place. And gently put this over. We want to make sure that there's no folds in the tie. You want to try to have it as straight as possible, because some of those like kinks and folds really do irritate the skin. They'll cough up a lot because it'll just be irritating to them. Okay, so this is tie and secure. We would make sure with, I'm sorry, you can't see that. We would make sure that 2 fingers could go through, but it's not so loose to where that it's coming out. We would just make sure it's not, it's tight enough, but not tight, as long as our fingers could go through. Just like that, comfortably. So now we're gonna go ahead and put a new set of gauze. Okay. We're still asking if they're okay, they're fine, their oxygen's doing good. We have everything in place if we need to. They're doing okay. And then I just want to make sure that there's not really any wrinkles or creases inside the gauze that I'm placing right over, because that can also irritate them. Where I have it tied, I would like to put another gauze there, and I'm just gonna fold it over on the outer side of the patient so it's not itching them or bothering them. And we would just tape the bottom ends, never tape anything to the patient's skin, just the bottom end like that, so that way it does not bother him at all. Once that's done and in place, we would keep the pulse ox on a little bit longer just to make sure he's okay. We would gather our supplies, get rid of them. We would put them back into a comfortable position that they were in prior to us starting. We'd make sure that the bed is locked, their call lights in reach. We would open back the curtain up for privacy. After we cleaned up and, you know, of course, performing hand hygiene, and we would document our findings. We would document that we did the procedure, and that if there was anything that we found, if they had any discomfort, if there was anything different we had to do in between, if there was any discoloration, any new changes, anything at all, we would document that. Or if, of course, in emergencies, let the provider know right away. Other than that, I think that's it. Thank you.